All right. Welcome, everyone. Thank you all so much for joining this information session for the University of Washington's online MPH program, or the Online Master of Public Health program. This is one of the many Master of Public Health programs that we offer here at the University of Washington School of Public Health, but it is the only one that we offer online. So if you're looking into our other programs, you'll see that we have many other tracks that are offered in different departments that offer different um, concentrations and focus areas such as epidemiology, global health, environmental and occupational health sciences, public health genetics, food systems, nutrition and health, as well as our department's own health systems and population health MPH, as well as our community oriented public health practice MPH program. So there are many MPH options here at the UW, and this is the one that we're going to be focusing on today, the only one that we offer online. And it is what we consider a generalist MPH program, and it is offered within the Department of Health Systems and Population Health, where our main focus areas are going to be around US-based health systems, healthcare, policy, community health, and related research. Now, my name is Wade Angeli. I am your host for today's session. I am also the main point of contact for all prospective students and applicants to the online MPH program, as well as a few other graduate programs in the department. So today's session will be a grand overview on the online MPH program, pretty much everything you need to know to determine if this program would be a good fit for you and how to pursue it. So first, I'll start by talking about our program's mission and goals. We'll take a look at what the student cohort looks like, and as well as the sort of demographics that we see for our cohort in the program. We'll talk about the career outlook for our graduates and what kind of areas they end up working in. We'll give a grand sort of breakdown of the program's format itself, the different full-time and part-time tracks that we offer, as well as our in-person sessions, as it is technically a hybrid program. We will talk about the curriculum and the course sequence. We'll walk through all the admission requirements and the process to apply. We'll talk about cost and aid, and then I'll have some resources for you to learn more, next steps to take, and time for questions and answers at the end. So the online MPH program at the University of Washington has been around for almost 50 years at this point. It has definitely transformed over the years, but it's always been focused on sort of promoting the next generation of leaders in public health. It's always been a distance program or a hybrid program with a focus on leadership. So the mission of the program is really to prepare the next generation of outstanding and diverse leaders in public health with the mission to improve the health and well-being of our population, our communities, all with a keen eye to promoting health equity and access and social justice. So this program is really going to be often the next step for public health professionals who are hoping to move into more leadership or management roles, to really build up and develop their professional skills so that they can advance their careers. While it is also often a key point in professionals' sort of journey to transition into public health from maybe a different related or non-related field. So we do see students coming from both of those backgrounds, coming from all different types of academic and professional backgrounds, where some are really using this as, the MPH, the master's is now sort of the main standard for accessing higher roles in public health for management and leadership, but also for those who may be coming from a different background, different academic or professional background that are wanting to transition into a career that's specific to public health. So regardless of where you're coming from, we do touch base with everyone to make sure that everyone's up to speed with the most current ways in which we discuss, identify, and address public health issues and disparities, and walking through all the different methods and approaches and principles of public health work, public health practice, improving the work that you may already be doing in your communities and in your roles, and performing better and to advance the field. So, of course, if you're already working in public health, this will be a great value for you to for your own current role or your current employer. But again, helping you to access those higher roles in leadership to really lead transformative and impactful change that we want to see in health of our communities and populations. Now, just a quick look at our student body, sort of a snapshot, so that you understand our program is a cohort-based program where we have a cohort typically around 35 students, sometimes a little bit smaller, sometimes a little bit larger, that start every autumn quarter at the University of Washington. I have some demographic information here, just kind of to give folks an idea that the majority of our students are coming from Washington State. They are Washington State residents. Of course, you don't have to be a Washington State resident, but being the University of Washington, the largest public state institution in the state, it's no surprise that the majority of our students are coming from somewhere in Washington, but not just limited to the Seattle, Tacoma, Puget Sound area, but all across the state and in other rural communities in central and eastern Washington as well. We do have a very small number of international students. This is where I just want to mention that international students are welcome to apply and enroll in the program. But in order to participate in our in-person sessions, they must independently hold a visa status that allows them to study in the US. So if you are admitted and enrolled as an international student, you will not qualify for getting a student visa because this is a mostly distance online program. So international students will have their own online orientation where all US-based students or students with a visa are essentially required to attend our in-person orientation, which I'll talk about more in just a moment. But I talk about this, we bring this slide up because we want our program to really accurately reflect all the different communities that we are serving. So our program is diverse in all senses of the word, folks coming from different academic backgrounds, professional backgrounds, from different times in their career. We have a number of younger professionals who may only have a couple or a few years of professional experience, where we have other mid or even later career professionals who have, 10 or more years of professional experience that are coming back to school. And, we have folks from all different identities and backgrounds to, again, accurately reflect the communities that we are serving. So the career outlook for this program is very strong. The vast majority of our students are already working full time while in the program. That's often the main reason why students are choosing this program, because it is not really feasible to maintain a full-time day job, full-time employment while enrolled in one of our in-residence programs. If you are considering another program, I encourage you to, reach out to that program directly and talk to them about it. But generally, it is not really feasible to maintain a, 9 to 5 and attend those in-residence programs. Whereas with our program, it has been designed so that it can be accessible and convenient for those who do work full time. So I say that because many students may not change jobs directly after graduating. They're already working, but some students actually will find new jobs while they're currently enrolled in the program, using different resources and different experiences that they gain in the program to access those opportunities, or our students are finding new jobs or promotions at their current employers within a year or a couple of years after graduation. Our alumni are mainly working in these main buckets of public health or health-related fields that I'll kind of break down here. Um, this is mostly in line with the focus areas of our department, which is again health systems and population health. So many of our alumni are working in and around healthcare. Some are coming from direct service healthcare professions. We do see all types of healthcare professionals come into our program to move into more either upstream or sort of program management and move maybe slightly away from direct service. But we do see, clinicians and physicians, nurses, physical therapists, dentists, all sorts of healthcare professionals come into this program. And after graduating, they may still work within a clinic or hospital environment, but more doing either program management or managing different teams or managing projects, or even working on in research associated with those healthcare institutions. Another big reason why our students are choosing this program is because our focus on U.S. health systems, in terms of like public programs and policy. So many students are working in government agencies at all levels, from local health departments, state departments like Washington State Department of Health, or Public Health Seattle-King County, our local jurisdiction here in Seattle, to the federal level like CDC or NIH. So these sort of government or government affiliated agencies doing policy or associated public health work. We also have a number of students who are coming from a research background or are interested in continuing to work or support research, and that could be at any of these sort of areas, but oftentimes they may be working at research centers in academia. So the University of Washington has dozens and dozens and dozens of research centers. Our department hosts a number of research centers and research projects alone, but there are, dozens more across the School of Public Health and then beyond, all across the UW. So we do have alumni working at those research centers, both in our department, in the school, and at the University of Washington at large, or in other institutions and agencies of higher education. Then the next sort of areas that people are working in might be more private companies, pharmaceutical related, or health insurance, or research firms. And then a number of students are mostly interested in grassroots, community organizations or nonprofits or foundations, working towards community health, or even things like sort of like fundraising or supporting different types of nonprofits or NGOs. Now, a number of students who come out of this program might find themselves not really working in what is typically considered a health-related industry. And I think that's important to note because the skills gained through the MPH are very easily translatable to other fields. So we have alumni who are project managers outside of the health sector, folks that are working more in community relief or sort of community or employee relations. So anything from HR or liaisons with communities for, any type of company. So I think that we don't see it as much, but it is important to acknowledge the translatable skills gained in the MPH and how they can be applied to other fields and industries. Now, this is just a very basic list of job titles, a very sort of most common job titles that we see from our graduates. And they're often coordinating, managing, directing research programs or projects. Obviously, there are going to be specialist roles in all different aspects of public health that we see our students and our graduates obtain, and they're working in really every type of discipline across public health, but these are the most like typical or most common that we see. But of course, the types of roles that you may qualify for will also depend on your prior experiences, like if you have another advanced degree or if you're coming from a health care profession. So, the unique marriage of your prior experience and the MPH can open up different opportunities, whereas the MPH alone will qualify you for many roles in, again, coordinating, managing, or directing programs, projects, and research. Now, the program itself is a 63 credit program. The UW is on a quarter system, and I'll talk about in just a moment the two different tracks that we offer. We will take a look at the curriculum and all the courses in just a moment. And I want to mention that as part of those 63 credits, we do have a 4 credit practicum, which, if you have not heard of our practicum before, it is essentially uh, a project-based appointment where you are completing some sort of project or deliverable with and for a public health agency that you're placed with, and doing this sort of externship over 160 hours. Now, I could talk about the practicum for a lot of time, but we don't have too much time to talk about it right now, so I'm just going to talk about a few key points. The practicum is going to be the key experiential learning component of our program, where you are taking everything that you learned in the first year and synthesizing it and applying it to a real world application or project. And it can be done a number of different ways. For our program, the online MPH program, our students are largely doing their practicum in a remote or hybrid capacity, and they also have a longer time to complete those hours. So it can be completed over the last 3 or more quarters, depending on if you're full-time or part-time track. This is a difference from our in-residence programs where they typically just have the summer quarter to complete their practicum, and they may be taking a practicum class while they complete their practicum. For our program, it's a little bit different. We've just broken it up over many quarters, so it's easier for our students who, again, are often working full time and then also doing school. It makes it essentially easier for them to complete those hours and take a little bit more time to get the most out of that practicum experience. The last thing I'll say is that our students are often, going about it one of two ways. Oftentimes, our students will know exactly what kind of thing that they want to do for their practicum, or they might have a specific agency in mind, an organization that they've already worked with, or perhaps their own current employer. And that can be arranged. It would have to be a unique appointment with a different supervisor or in a different department, but it can be at an organization that you already have a relationship and you kind of want to build it yourself. Or our students may want to take time to explore all the different organizations that we have partnered with. Hundreds of MPH students at the UW are doing a practicum every year, and some of those practicum sites are long-standing partnerships where there's ongoing projects or just like consistent engagement that you might want to take advantage of all those different relationships that we have with all these incredible organizations. So there's a lot more information about the practicum on the website. There's a whole practicum page where you can look at previous examples. Every year in April, we have the practicum symposium where our students are sharing their projects. You can come in person for the in-person symposium to learn more about it, or you can look online and see the synopses of them, or you can also join the online presentation. So it's never too early to start thinking about it, but you'll be introduced with as a student in our program. It'll be planted as a seed from the very beginning of the program, and then you'll have time to get it set up and even more time to complete those hours. All right. Our program also culminates in what we call the integrative learning experience. It is essentially a capstone course, so a final project, which is a very structured public health review that essentially we've crafted a course so that it's easier for our students to complete that final project, not necessarily independently, but within the support of a course. So that is our culminating experience. We do not offer a thesis, and our capstone project is this 4 credit integrative learning experience in the final quarter. All right, so I've already mentioned that our program offers both a full-time track and a part-time track. The full-time track is 2 years. It is essentially the same length as our in-residence 2-year programs, but the credits are dispersed a little bit differently. So we do have classes in the full-time track for 7 continuous quarters. So it does run through the summer quarter. In the in-residence programs, they typically have the summer classes off, but that is when they're doing their practicum. It works out to about 9 to 11 credits per quarter for the first part of the program. And then the credits kind of cut down a little bit less by the end of the program when you're focusing on your practicum and your capstone course. We estimate at the UW Graduate School that 1 credit is roughly 3 hours of work per week. So when we're looking to at 9 to 11 credits per quarter, we're looking at around 30 to 35 hours of work per week. And this estimate does include everything that you need to do as part of this program, and what does that actually look like. So we have, recorded lectures that you watch on your own time, but then there's different modules and tasks to complete within our online learning system. We use a system called Canvas. If you've ever done any sort of online learning system, it'll probably online degree or online learning, it'll probably look very familiar. It's very easy to use, very user friendly, and everything is hosted in one place, so it's very easy to access all your resources and materials. Now, of course, you'll have assigned readings, and your mileage will vary based on the way that you read and digest the content. And then you'll also have asynchronous discussions to partake in. So all of that, including our weekly meetings, which I'll talk about in just a moment. But first, let me explain the part-time track, which is 3 years. So 1 extra year. And this could be very key for those who are working full-time, even more than full-time. If they have just a lot going on in their life, it can be really difficult to manage that 30 to 35 hours per week on top of a full-time job because our students are, if I haven't already said it, this is not a self-paced program. We do have weekly sessions that I'll talk about in a second, but you have to keep up with the pace of the program. And so it can be a lot to manage. And our students are, spending time every night and extended time on the weekends, whatever works for them, to get it done. But the part-time track is going to be typically one less course per quarter, which means it'll be closer to 20 hours of work per week, which can be a lot more manageable for those with a lot of other commitments. Now, the part-time track is 10 quarters with the second quarter off. Sorry, the second summer quarter off. So you do have classes the first summer quarter, and then the second summer quarter is off, but you'll likely be working on your practicum at that time anyways. Um, all students actually start together, regardless of if you're doing the full-time or part-time track. We have everyone start together in the first quarter, taking 10 credits. And that's because we have a 7 credit course and a 3 credit course that are both essentially prerequisites for the rest of the program. So we want everyone to start together with those 2 courses. So it's really not until when you're registering for your second quarter that you need to decide if you're going to continue full-time or drop part-time. When you apply to the program, we do ask what you're considering, full-time or part-time, but you don't actually have to decide until you register for your second quarter. And even then, if you are pursuing the program on a full-time capacity, and then something happens and you need to go drop a course or go part-time, that's totally possible. It's very flexible for our students to switch to the part-time track. Now, if you're part-time and you want to pick up to full-time, that's where we might run into a few roadblocks just because we don't offer our courses every quarter. Typically, our courses are really offered only once per year. So if you deviate from our established full-time or part-time tracks, you'll just have to work directly with our advisor to sort of get your expectations in line of and have a personalized sort of course sequence. Just because, we don't want anyone thinking that they can do part-time and then oh, they actually want to pick up another course, but that course that they're looking for is not going to be offered for another few quarters. So again, if you stick to one of our our tracks, our full-time or part-time track, you'll run into no issues. It'll be a very smooth experience. But we do want to be able to provide flexibility for students. We understand that life happens, but this is just a caveat that we don't have that much flexibility because our courses aren't offered every quarter. All right. So I've kind of already talked about how our program is a hybrid, technically a hybrid program because we do have some in-person sessions. But another important thing is that we are not a self-paced program. We are not an isolated program. We fully utilize the cohort model so that our students are constantly and consistently engaged with each other. While we don't have any daytime classes and most of the work is going to be asynchronous, so that you can complete the work at a time that's convenient for you, you will have to keep up with the pace of the program and you will have to complete certain things before our weekly meetings that are 7 to 9 p.m. Pacific time on Thursdays. So this is really important if you are not in Western time zone or if you would be an international student based somewhere else outside of the US, you have to make sure that this time frame is going to work for you because these weekly meetings are required. These meetings will have they will vary throughout the quarter. At the beginning of the quarter, you'll have the exact schedule to know exactly which course is going to be for what time slot. So, for example, one week you might have one course from 7 to 8, and the other from 8 to 9, you'll have an instructor from the other course focusing on this live session, which is not just a live lecture. It is often discussions. It is often breaking out into breakout groups and doing group work together. There is a significant amount of group work in this program as we are trying to accurately simulate the type of work that is done in public health, which includes a lot of collaboration and compromise. And it's really important that we have that aspect of working in teams and applying leadership skills in those teams. So that is all to say, you will have the schedule of your weekly sessions and you will know what you need to have done before those weekly sessions. You may have a week, you may have 2 weeks to complete certain tasks or reading and have that all done before you come together in the weekly synchronous meeting that again is on Zoom from 7 to 9 p.m. Pacific time every Thursday. Now, besides those Thursday sort of standard meeting times, we have in-person sessions for you to participate in. The first is our required orientation that is here on campus. We do have other sessions throughout the remainder of the program that will be optional. So like a midpoint, some maybe just like meetups, and then the formal close to the program or graduation. So just as a kind of basic schedule, when the program begins is going to be in line with the academic calendar of the UW. So our first class is after the autumn quarter starts, which is typically mid to late September. This autumn quarter, it's pretty late. So like our first day of class, I believe, is actually October 1st. I think that's the Thursday. But typically it is like the third or fourth week of September that instruction begins. Orientation will be the week before instruction begins. It's typically a Monday through Wednesday, and so our students are taking time off as needed from their jobs in order to come attend these basically full day sessions here on campus in Seattle. Orientation is really critically important for many reasons that I'll get to. But the other sessions are optional. So we have a midpoint, which is 1 year into the program if you're a full-time student, or it could be, 2 years into the program. If you're part-time, you can take part in both of those midpoints. And it is sort of cross cohort. So it's an opportunity to meet other students in the program or that are on the part-time or full-time track from other cohorts. And that is typically a like a Friday or a Saturday or both. And we do like an online and an in-person version. And then finally, graduation. We typically do some sort of graduation for the students in our program. But as a UW student, you're also welcome to participate in the larger commencement. But most people typically participate in the UW School of Public Health graduation. So our graduation ceremony might be before or after. This year we did like a breakfast before the official School of Public Health graduation. Other times we've had our own reception on on a separate day. So that will depend on, what the cohort is looking for and what the graduation schedule ends up being. But back to orientation. The main focus for the in-person orientation is really just for our students to meet each other face to face, to meet each other who are going to be their classmates and their colleagues, because we don't want our students to have to sacrifice some of the best benefits that come with graduate school. And that is really going to be the connections that you make with both your cohort mates and the instructors and everybody else in the larger community at the University of Washington. And so we think it's really important, and it's also just a lot easier to maintain relationship with your classmates if you've already met them face to face rather than just being floating heads on a screen that you have never met or connected with in person. I think it's critically important for our students to be able to connect and come together, kind of have some team building activities, basically just like getting to know each other, sharing a bit about where they're coming from and finding those connections and really building that community that, again, is a really key part of our team-based learning approach in our cohort. And I think it's one thing that makes our program really unique, because although we are mostly asynchronous and mostly online, we do have these critical in-person sessions and weekly meetings that are better to serve our students and accurately simulate the kind of work that they're going to be doing in public health. Now, we do have a lot of important trainings as well as part of orientation. So, walking you through all the different resources that are available to you, getting in touch with our instructional designers and our education team, meeting the faculty, meeting the other resources and staff at the School of Public Health that provide different services like career services, and there's an important anti-racism training and different sort of basically a grand introduction to our community at the University of Washington. One last thing about the in-person orientation is the R workshop. So Project R, or just the letter R, is the statistics computing program that you're going to be using, particularly in the first quarter in our quantitative sort of epi and biostats course. And so we have a workshop over 2 days to catch our students up to speed and make sure they have all the basic skills and understandings of the program before diving into the course. The rest of the orientation is not content-based. It is all added value to really introduce students to each other and to ourselves, and again, create that community for the cohort. All right. So I have the course sequence here. I'm not going to spend too much time talking about the curriculum today. There are course descriptions for all of these classes on our website that you can learn a little bit more. Right now, I'm just going to walk us through the course sequence that as it is for full-time students. The part-time sequence is on the website as well for you to look at. Basically, it's going to be slightly different after your first 3 quarters, because all students, regardless of if they're full-time or part-time, need to complete these 6 PHI classes in sequence. And these PHI classes are what's known as the Common Core, MPH Common Core curriculum. So they're the same foundational courses that all MPH students at the UW take, and they're going to be prerequisites for all of our other courses. Now, I mentioned at the very beginning that our MPH program is considered a generalist program with a focus in leadership. Our program does not offer any electives or concentrations. So instead of electives, we've really spent time and crafted the most sort of both broad curriculum that touches on all the different main disciplines of public health, but also that are going to be most in line with folks who are interested in working, again, mostly within US-based health systems and healthcare policy, community health, and research at a higher level in terms of project and program management and leadership. So, um, you will be taking these PHI 511 through 516 in sequence, both full-time or part-time. And then in the part-time sequence, you'll be just taking a slightly different order of the rest of our courses. So, again, regardless of if you're full-time or part-time, everyone starts together in the first quarter. And then it's at the second quarter when you decide if you want to take two courses or three courses. Now, on top of the PHI courses, we do have these courses in health policy and applied research methods. We have a global health course, health program evaluation, environmental and occupational health, and then our unique two-part public health leadership course that's only available in the online MPH program that focuses on everything from organizational and financial management to systems thinking. And then we have project management and health communication and marketing for health promotion. I have the practicum here with an asterisk because I didn't put it in the rest of the quarters. So technically, you'll be enrolled in the practicum in the fourth quarter as well as the sixth and the seventh quarter. So you have after you get it set up in the fourth quarter, that's like a 1 credit quarter for you to get it set up. And as soon as it's approved, you can start working on your hours. And then you have the fifth quarter, the sixth quarter, and if necessary, the seventh quarter to complete it. You'll be registered for the practicum in the seventh quarter, but most students are we recommend, and usually it's possible that our students are finished fully with their practicum before the seventh quarter so that they can just focus on their integrative learning experience capstone course. That is sort of the ideal situation. In the part-time sequence, it is pretty similar. You'll still be registered for it, but you'll have even more extra quarter to complete your hours. And again, we've just done this to make it easier and more efficient for our students who, again, are often working full-time on top of doing this program. Again, the full curriculum is online and you can read more about these courses. If you have any questions about the curriculum, we can talk about it later, but I'm going to keep going. So next, the admissions. The minimum admission requirements for this program are very straightforward in that all applicants must have a bachelor's degree, and then the UW Graduate School has a 3.0 GPA requirement. If you have multiple degrees or taken multiple courses after your degree, your GPA will be calculated from your most recent graded credits backwards. But if you have a 3.0 cumulative GPA for your bachelor's, then you don't really have to worry about doing a calculation. Now, a unique requirement of our online MPH program is that all applicants must have at least 2 years of full-time professional experience. This does not have to be public health professional experience, but it does need to be real-world professional experience in the workforce. This is really important for our program. It's not minimum admission requirement for other programs, but for our program, as we focus on leadership, it's important that our students have some professional experience so that they can better apply all the different management and leadership components of our program. So it does not have to be 2 years in one place. It can be a couple different positions over time. But if you are, if you just have maybe a few months here of part-time work, a few months here of part-time work, and you're coming directly from your undergraduate degree, that's where our admissions committee might think this candidate would benefit from more post-bac professional experience before coming into this program. Although it does not have to be post-bac, so if you worked full-time or have several years of experience before you completed your bachelor's degree, you can still qualify for this program and could be a good candidate. Now, if you have any specific credits, if you have any specific questions about your own eligibility, and if you meet these requirements, feel free to reach out to me directly. I'll have my contact information at the end, and we can have a discussion about, if this is the right time for you, or if you should have some more experience before applying to our program. Now, in order to apply for this program, we have our timeline. So the next available entry will be autumn 2027. Autumn 2026 admissions did just close July 1st. So we have our priority deadline January 15th. This is so that students can apply earlier and get a decision sooner, but it doesn't mean like priority for getting into the program because we guarantee consideration of all applications submitted by our general deadline, which is April 1st. Now, after April 1st, we may accept additional applications for rolling admissions based on space available in the cohort. We have pretty much consistently accepted applications or had a rolling admissions window after our general deadline through the end of June, at least for the last couple years. So in case you missed this one of these deadlines, do check back on our website, reach out directly and confirm if we are accepting additional applications. We can't guarantee it at this time, but it is pretty common for this program to accept additional applications. And that is often because we have a good amount of capacity for this program, and we're not denying folks because we don't have space for them. We have not had a wait list since like 2020, 2021. So, we have the capacity for students, and we're a little bit more flexible in our application timeline to be able to accept later applications. But if you want the soonest decision possible, we encourage you to apply by our priority deadline, and you'll be given a decision typically uh, by mid-March or by the end of March after January 15th. Now, I have this slide that breaks down the application process. It does kind of look a little bit overwhelming, but I have a few things that I really want to point out. Otherwise, I generally recommend you to look at our admissions webpage on our website, which has it broken down step by step. But also, if you know that you want to apply to this program, the best thing you can do is to go ahead and start an application in both of our application systems. So that's the first thing that I want to bring up is that we have a two-part application in both SOFIS, which is the common application for schools and programs of public health. That's where the bulk of the application materials are submitted onto SOFIS, but we also are required to gather a UW graduate application from our applicants, which is more like a supplementary application, but that is where your decision will come through, and that's where your enrollment record will be created if you're admitted. In the UW graduate school application, it's pretty straightforward in terms of general information, unofficial transcript copies, English speaking proficiency. If you are not a native English speaker, that is submitted through the UW graduate school application, and there is a $90 application fee. However, if I'm talking to you live right now, or if you're attending an info session live at some point, your attendance will be taken and you will qualify for a $90 application fee just for joining this session. So I will be sending out to our attendees a follow-up email as long as I have your name, that it matches the name that you registered with. I will be able to send out these slides with instructions on how to utilize that application fee waiver. Now, the SOFIS application is a bit more of an undertaking in that that is where the majority of our materials are going to be submitted, and it is a larger application in general because you can use it to apply for multiple schools or multiple programs at the same time. So, you will have to fill out a basic general information sort of profile with your background information. SOFIS does require you to submit official transcripts to SOFIS for verification. However, that aspect is optional for our program's application, including our other MPH programs in our department, HS Pop. So what that means is if you're only applying to the online MPH program at the UW, you do not need to submit official transcripts to Sophus for verification. You can skip that and say, I already sent my transcripts. You just need to submit unofficial transcripts in both Sophus and UW Graduate School because that is what we're going to look at. Basically, it's to help our applicants who might just only be applying to our program save some time and money so that you don't have to pay to send official transcripts. Because if you're admitted, you still have to send, regardless of if you submitted them on Sophus, you do have to send official transcripts to the UW Graduate School for verification if you are admitted. So that is one thing that we offer. The next thing is that we offer a bypass of the manual course entry section, which is basically you have to manually type in every course from your transcript that you've taken, or you can pay a third-party service to do that. We say you can just type in one course and skip the rest of the sections, again, saving some time and money if you are just applying to our program. Now, if you're using Sophus to apply for multiple programs, we do not recommend you to skip those sections because those other schools or programs might consider your application incomplete or unverified if you skip the official transcript order and the manual course entry. Anyways, you have to submit your CV or resume and your 3 letters of recommendation. Those are designated directly within the Sophus application. So you give the name, the email, and it shoots them an invitation to complete their letters. Those letters can be used across your different applications. So they should be pretty general if you're going to be applying to multiple programs, or they can be specifically tailored to our school if you're only applying to our program. Now, Sophus does have an application fee. It is 100 right now. It could change for the next year. I'm not positive, but it is $150 for the first program and then $60 for each additional program. Sophus does offer limited fee waivers that are on a first come, first served basis that are typically exhausted by December 1st. So if you are interested in trying to take advantage of a Sophus fee waiver, you have to apply for that. If you're granted one, you have to submit your application within 2 weeks. And again, they are often exhausted well before our January 15th priority deadline. So we do encourage you to apply earlier by December 1st to make sure that you can get a fee waiver through Sophus. Unfortunately, we do not offer any coupon codes or fee waivers for Sophus through the UW, and that is another reason why we offer the $90 application fee for our own application system. Now, I'm just going to walk through the other application materials really quickly. We do have many statements required. So that is a personal history statement, a mission, vision, and value statement. Those are under the School of Public Health requirements because those are going to be the same for every program that you apply to at the UW. We have a specific statement of purpose for our program. So statement, why are you applying to this program? What are your goals? We have specific prompts for every statement that are going to be on our website as well as directly within the application. And my best sort of advice is to really pay close attention to those prompts and make sure you're responding to everything that it's asking for. We don't have an interview process for this program, so these statements are very important for you to be able to tell your story, explain your clear motivations and goals, your reasons, connect the dots for our admissions committee. They're critically important for you to really advocate for yourself and make a clear reason why this is a good fit for you and how you're a good fit for our program. We have some short questions like how are you interested in online learning and how you plan to incorporate it into your lifestyle and your sort of work-life balance. We have an academic history question, which allows you to provide additional context. For example, if you have a GPA that's slightly under 3.0, or if you did poorly in a class, or what other steps you're taking to prepare yourself for the quantitative demands, as well as the writing demands of the program. And then I mentioned before, we ask your desired program length, either full-time or part-time track, but you're not locked into it just based on that program. Finally, you're going to link your 2 applications together. So you're going to take your Sophus ID and put it in your UW application and vice versa so that they are paired up and we can find them both in both of our systems. All right, so that was like my least favorite slide because it is a whole bunch of jumbo. mumbo jumbo, but again, we do have step-by-step instructions on our website, and I think it's a little easier and easier to process if you've gotten a little bit of a breakdown and then go directly into the systems and you can see it all and navigate it directly within the application system. All right, so one of the last things we're going to talk about is the cost of the program. It is really important for you to understand that this is what's known as a fee-based program, as opposed to a tuition-based program where you're going to pay tuition based on your residency, quarterly tuition based on your residency. We charge the same cost per credit to all students regardless of residency. So it's going to be the same cost for in-state, out-of-state, and international students. That cost is currently $1,003 per credit. So for 63 credits, we're looking at $63,000 um, uh, just about for the credits. That does not include quarterly fees, which are typically like $400 per quarter. That includes mandatory registration fees and other mandatory UW fees that include like facilities and services that unfortunately it doesn't matter if you're going to take advantage of it or not, like if you're not um, local to the area. But if you are local to the area, you get the U Pass, which is your unlimited transit pass, access to the all the different facilities on campus and things like that. As a fee-based program, unfortunately, the online MPH program is not eligible for use of the Washington State or UW Employee Tuition Waiver Program. Would only apply to a tuition-based program as it is a tuition waiver. Otherwise, all other types of funding would apply as normal to this type of program, like financial aid or institutional scholarships or external funding, whatever it is. All online MPH applicants will be automatically considered for any program or department specific awards that we might have available, which include a $5,000 H-Seat award, which is we get one of those each entry quarter, once a year. That's a departmental award. And then we have multiple $3,000 Public Health Leadership Promise Awards. That's an award specific to our online MPH program. So again, there is not currently an application for these programs, for these scholarships. We will award them as part of our admissions review. Now, the UW School of Public Health does offer many other awards, including the Master's Fellowship Award, which is up to $20,000, but most other institutional scholarships, like ones offered through the School of Public Health, are only going to be available to enrolled students. So they might not be available for you to apply as an applicant. They'll only be available to apply for once you're enrolled as a student in the program, and they are released throughout the year. You can utilize a couple different resources to help find funding, like the UW's Graduate Funding Information Service, which is like an award board where they're posting all different types of funding opportunities. There's also a resource list on our website that helps you to find different opportunities and scholarships. And then, of course, the Office of Student Financial Aid at the UW is going to be your contact for advising regarding financial aid. We also have the UW Veterans Education Office that is a resource to those who are either active military or veterans or that would receive those types of benefits. So I can't really advise for financial aid, but again, you have the UW Office of Student Financial Aid, and I can generally say that our students are often utilizing a combination of funding. Because most of our students are working full time, they may be largely self-funding the program, maybe with some support through financial aid and then smaller awards or scholarships. But it really, for that, it does come down to each individual student seeking out those different types of funding opportunities and they do just add up. But it will, besides the two awards that you're automatically considered for, you will have to seek them out and apply for anything else. All right. So we're almost at time. I just have a couple last things to plug. We do have some student ambassadors that if you want to get in touch with them to learn more about the program from their perspective, you can get in touch. We have a lot of great content on our website, like a video interview with one of our past students, Zaina Bakari, and some other articles about our students and alumni that you can learn more. I have this sort of wrap up slide and then I'll have time for questions. I know we're actually, unfortunately already at 1 o'clock. I apologize for that. But if you have some questions that you didn't get to ask in the chat or I didn't get to answer yet, please go ahead and enter them in the chat. I'm happy to stay on for a few minutes after the session ends. So if you're heading out, I just want to say thank you so much for attending the session today. I hope this was helpful for you to learn more about the program. These are sort of my closing points of why you should consider this program, why it could be a good fit for you. And then the final slides are my contact information where you can email me with any of your questions at any time. As long as I have your name, I can, in the Zoom, I can, send you that follow-up email. Now that you've attended a session, you're welcome to book a one-on-one advising appointment with me if you have many questions or want to have a more extended conversation about your candidacy for the program. And then the final slide is a list of our other MPH programs and other master's programs in our department with their some links and their contact information if you're considering multiple programs. All right. So why would you consider the online MPH program at the University of Washington? Now, to sum it all up, we are training the next generation of public health leaders, and we've been doing it for over 40 years through this unique hybrid team-based learning approach program. Our program, our department, and our school all share this foundational commitment to equity, diversity, inclusion, and anti-racism, as we are really keenly focused on social justice and improving and promoting health equity and access. As we've been doing this a long time, we do have an extensive network with over 1,000 alumni working in all different areas of public health, across all different disciplines and all different types of roles at all levels. That is a really incredible community and resource for our students. Now, I've already kind of mentioned this many times, but our online, hybrid, and team-based learning approach really fosters connections and collaborations, and creates a really strong community of support for our students, so that our students who are not able to attend a typical in-residence and graduate program are not sacrificing that really incredible experience, and they're still getting that even through this mostly asynchronous and online program. Our instructors are visionaries and leading public health practitioners, policymakers, and researchers that are really incredible faculty and incredible resources for our students. And if you're not already aware, the state of Washington is at the forefront of public health policy and innovation. It is recognized as a leader nationwide with groundbreaking initiatives and policies. And Washington is really where a lot of exciting work is happening, specifically in public health. Now, you may already be aware that the UW School of Public Health is a top-ranked global university, one of the best universities in the world, as well as one of the best public health universities and public health programs in the US. And if you're not already local to the area, Seattle is a wonderful place to live and visit and work. And if you haven't already been, it's a wonderful place to visit for our in-person orientation.